Nurses are such an important part of the helping and healing world. And nurses are under a lot of stress and a lot of threat right now. We have changed the cultures of the medical systems, and in some ways, nurses had a tough job even in the old days when we had a little more room in the hospital and in the health system to do the right thing and to act in a humane way. I mean, the doctor is the top of the pecking order, and some doctors were not and still are not partners of the nurse and respectful of the nurse. I certainly remember situation after situation in the course of a medical education where it was very important to know who the good nurses were and what they were thinking and what they were doing and talk with them about patient care. Well, nurses carry the bulk of the burden in our hospital systems. Maybe not so much in the private doctor's office, but we're having managed care, and this tends to reduce the human space in the system. A colleague of ours, Lori Barkin, wrote a fantastic book based on her work at San Francisco General Hospital, and through her eyes, you can see what the nurse goes through in terms of stress and in terms of loss of human resources as things are reformed and as cutbacks occur. And in some situations, the nurse herself and himself is losing the ability to do what needs to be done. So they have a caregiver burden, a compassion fatigue, a burnout problem, and we need to pay a lot of attention to the traumatized nurse.